Terpin hydrate is an expectorant used to treat bronchitis, pneumonia, bronchiectasis, COPD, and infectious or inflammatory diseases of the upper respiratory tract. In this video, let's find. What is terpin? What is terpin used for? Contraindication. What are the side effects of taking terpin? How does terpin work? How to use terpin? What is terpin? Terpin, used as the hydrate, terpin H2O, is an expectorant, used to loosen mucus in patients with bronchitis and related conditions. It is derived from sources such as turpentine, oregano, thyme, and eucalyptus. It was used in the United States in the late 19th century, but was removed from marketed medications in the 1990s after the Food and Drug Administration, FDA, found a lack of evidence of safety and effectiveness. What is terpin used for? Terpin hydrate is used in the treatment of acute and chronic bronchitis, pneumonia, bronchiectasis, chronic obstructive pulmonary disease, infectious and inflammatory diseases of the upper respiratory tract. Contraindication. Hypersensitivity to codeine, terpin, or to any of the excipients in the formulation. Respiratory insufficiency. Cough due to asthma. Children younger than 15 years old. Pregnancy and lactation. All pediatric patients under 18 years of age who undergo tonsillectomy and/or adenoidectomy. Side effects. Adverse reactions include depression of the respiration, sedation, coordination disorders, constipation, and urinary retention. Long-term administration of the combination product of terpin hydrate with codeine may lead to codeine dependence. Terpin hydrate with codeine is often mixed with alcohol as codeine is not as readily soluble in water. Pharmacodynamic. It acts to facilitate the removal of mucus from the respiratory tract. It prevents the exacerbation of excessive mucus production and secretion due to airway bacterial or viral infections, asthma, or chronic bronchitis. Expectorants like terpin hydrate change mucus consistency and make coughing more productive. Mechanism of action. Terpin hydrate improves mucociliary function by working directly on the bronchial secretory cells in the lower respiratory tract to liquefy and facilitate the elimination of bronchial secretions as well as exerting a weak antiseptic effect on the pulmonary parenchyma. It is thought to increase the amount of fluid in the respiratory tract, which increases the flow and clearance of local irritants and as well as reducing the viscosity of mucus. Dose. Productive cough. Adult, usually used in combination preparations. Dose may range from 85 to 130 milligrams, taken 3 to 4 times daily. Safety advice. Terpin hydrate is available as a liquid preparation that contains a significant amount, about 42%, of ethanol. It should not be used in pregnancy. That's all the information about terpin we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.